Hi, I'm Leslie Sharpe, and I've been a family nurse practitioner for almost 20 years. My passion is providing health care for rural and underserved communities. Sylvan Health Center, which is a school-based federally qualified community health center, is an innovative partnership with Piedmont Health Services and UNC Chapel Hill School of Nursing. It's in Snow Camp in Alamance County. This nurse practitioner-led clinic is located in a renovated classroom trailer on the elementary school campus. Our motto is small but mighty. We only have 2 exam rooms, and we're the only healthcare providers in this community of 6,000. 5 years ago, when we opened the clinic, it was initially intended to meet the physical and mental health needs of the children in the community. And at the school, kids were missing valuable instruction time when the parents were having to travel from work back to the community and back to the nearest healthcare provider 30 minutes away. With access to the family nurse practitioner in the community, the kids were missing less school and the parents were missing less work. As we grew, adult patients began showing up who had not had access to health care for many years due to lack of insurance or reliable transportation. Bob and Lila were a couple who lived in the community but couldn't afford the gas to go to the nearest healthcare provider. Bob, a 60-ish-year-old hippie from the Woodstock era with a lanky Abe Lincoln-like stature, came to me for the evaluation of fatigue and joint pain. The arthritis and deformities in his gnarled hands were so severe that he was unable to make a fist or hold a glass of water without dropping it. He was now fully disabled. With earlier access to care, I could have referred him to the specialist and connected him with the necessary resources to help with transportation and medication before the damage was so severe that he was no longer able to be a part of our workforce. His wife's story was even more unfortunate. On Lila's first visit, her yellow skin hinted of an ominous prognosis. The liver cancer was already advanced, the tumor was large, she was in significant pain, and her time was short, 1 month. While the tumor was large, or while the outcome may not have changed, I have to wonder if she had had access to care, if we could given her more time. As it was, we gave them enough money to afford gas to go to the nearest ER to receive emergent workup, but we already knew the outcome was grim. She never made it back home. Al is another one of my patients who established care as soon as the clinic opened. He had not received health care in several years either, due to being uninsured. On his first visit, he reported a 20-pound weight loss, numbness in his feet, and an unquenchable thirst that even 2 liters of Mountain Dew a day couldn't satisfy. His blood sugar, needless to say, in the clinic was 450. If you don't know, that's pretty high. With a new diagnosis of diabetes, I was able to start medications, provide some basic diabetes teaching, and encouraged him to stop the 2 liters of soda a day. Within 4 months, his blood sugar control was almost at goal, and his sugars were now in the hundreds where they needed to be. Because of the proximity of the clinic to his home, he was able to receive the ongoing teaching he needed for the diabetes care. Otherwise, he may have ended up with hospitalization and having damage to his kidneys, eyes, or his heart. The access problem doesn't just affect the patients, it affects the caregivers as well. Ruth, an 84-year-old, had adequate insurance coverage. She had a primary care provider and several specialists, but they were all over an hour away. She was unable to drive to Durham by herself, so her daughter had to drive her and take time off work to take her to the endocrinologist, cardiologist, and rheumatologist every 3 months to manage her chronic diseases. Ruth was quite excited with the opening of the clinic because she was able to drive the 5 minutes to our clinic, which meant her daughter didn't have to miss work. As an experienced nurse practitioner, I was able to manage the vast majority of her care and coordinate with her other specialists to reduce her specialty visits to every 12 months. Kelly was another patient who came to our clinic as a new patient with chronic pain, depression, hypertension, and fibromyalgia. She couldn't understand why the narcotics weren't working for her fibromyalgia, and her depression was so severe that she was struggling to get out of the bed every day. After consulting with our psych mental health nurse practitioner, we changed her depression medications, tapered her off her opioids, and prescribed appropriate medications and lifestyle changes for her fibromyalgia. Within a couple of months, her quality of life was significantly improved. She was exercising, getting out with family and friends, and finally cleaning her house, which she was very excited about. The common factor between all of these patients is that they struggled with anxiety, depression, alcohol, or substance use. A whopping 90% of our patients at Sylvan Health Center have some form of mental health disorder. At Sylvan, integrated behavioral health is at the heart of our care. Nurse practitioners have been shown to like to work in rural areas. We are more likely to be taking care of these vulnerable populations. We would like to be part of the solution to help provide affordable, accessible health care in these communities that lack the necessary resources. Thank you.